Hey!
Take 4 is the charm.
We've recorded a few episodes so far without hitting play.
Yeah, we're really good at this.
Welcome to BustmobTV. In the spirit of living our life with intention, me and Gretta Nance found some time in our day to pause, grab some coffee, and chat about what's going on inside Bustmob. We'll answer some questions, interview a Bustmob babe, and share ways to be more intentional in your daily life. Hop on in.
So, we've been talking.
launch it.
Yep. We've said this already 9 times. So, sorry, Jenny, that you're having to rehear this, but I got really excited.
It's really good, so
Yeah.
I don't mind hearing it again.
Okay, good.
Yeah.
Well, on Bustmob Breakfast Club, a bunch this week, you've specifically been talking about self-care, and I was giving this example that I've heard from my girl, Brene Brown.
Your girl?
I think if I keep saying it, I'll manifest that she'll be like, oh yeah, my friend
I
Greta.
watched that episode.
I just love her. Her podcasts, her books, everything. But she said before, she recognized that, especially in her Enneagram Type 1 tendencies, in not taking time for self-care, she set a really poor example for her children because then they didn't realize or know, because they never saw it modeled, how to ask for what they needed or take some time away. So now she's like really into this. And I found this great article. I'll post it on my Instagram. How about that?
Good,
or we can share it somehow. But basically it talks about that whole concept of putting your mask on before your children put their mask on. Like on
the airplane.
On any airplane, yeah. Don't put on masks, but on the airplane. And it's like we've all heard that, but most parents are like, that's a difficult concept. Help myself before my child.
Yeah.
What kind of parent would that make me? But it's like, you can't breathe if... No, I messed that up. What was it?
It's like you can't take care of someone else if you're not taking care of yourself
We can't
first.
help our children if we can't breathe ourselves.
Yeah.
But that doesn't just mean a bubble bath or a glass of wine or a girls' weekend in Vegas. It's like, that is not self-care. That's called self-soothing. Nothing wrong with that. But that is truly not going to show our kids how to make themselves better and ask for what they need and set boundaries. So it says true self-care is not always glamorous. It's doing what we need to do, however small or not fun, to live our best lives. And it takes courage over comfort to choose to put yourself first. But that will ultimately show our kids how to do it.
I love that. Courage over comfort. Because it's easy to think of self-care as like a list of comforts and things that I want to do to make myself feel better. And while that could be someone else's form of self-care, like I feel like different seasons require different types of self-care.
Agreed.
Like the one that I'm in right now has required me to make a list of like different types of things to invest in myself. Self-care is not always a bubble bath. Like it is indulging, it's nice, but it's not going to get me to where I want to go.
Yeah.
So while pausing and reflecting is good, that could be a form of self-care. But really, I made a list. I got my journal, made a list of things that I thought like, what are some things that are going to make me a better person at the end of this season? And I wrote it down. And for me, that's self-care. Like that can be anything. It can be different for everyone. But I love the thought that every season can have a different list of things that can serve you best.
Yep. And it's not always easy. Like self-care sounds like a lot of fun, but it might be going back to school or those are hard things, but ultimately you'll be better because of that.
Yeah.
And it's not selfish. Self-care is not selfish.
That's right.
So, Bustmob continues to grow rapidly.
Yes, it does.
So much fun stuff going on in there this week. What were some of your favorite takeaways?
I've been seeing a ton of submental liposuction results lately. Have you noticed that?
I have.
Yes, and some of them are like super bruised, some not at all, and it's so crazy to see like how different everyone's surgical results are. Like someone said like that it hurt really bad, and someone was like, I felt nothing, and so it's so funny just to see like the range of how different people recover so differently. So it's hard when people say like, hey, how's this gonna feel? Every time I say, I felt nothing, it was a 0, and I'm like, but that's for me. Like, you should still be prepared.
Yeah.
You know?
We would be millionaires if we could figure out the recovery equation. Right. I have said that many times. Like, if you could plug in, I've had this many kids, I'm this old, this is what's happened to me, here's what your recovery is going to be, a 5 out of 10.
It's like a score.
It just, you don't know. I hate that it's a surprise.
It is.
But I do love submental liposuction anyway, because it's usually a pretty easy recovery. Jenny had it. But right now, everyone talks about that it's like the new Zoom surgery. Because people don't want to see themselves like this, and they're like, wait, I should do something. And this is a good thing to deal with before you're like 60 or 70. So Big fan.
A lot of people are asking too, like, does the skin get saggy right there? And it's like, no, this skin tends to like retract afterwards. The younger you are, the better.
Yes.
And they also did my jawline too, so I am here.
You are
for it.
snatched.
I love it.
That's what they say. The kids say.
So another thing we've been seeing in Bustmob is a lot of people asking questions like, hey, does this look normal? Or my boob is extra swollen over here. Is it a hematoma? Like, kind of more medical questions. And it's like, I'm so glad that you feel comfortable asking those questions, but we have a subgroup where we have plastic surgeons in there who can answer those types of questions for you better than a bunch of women who are just speaking from experience.
Yeah. Even though, honestly, some of the feedback is really good sometimes, it's really great to ask a medical professional.
Totally.
And I know a lot of times it happens on a weekend or in the evening and you can't get a hold of your surgeon. It made me feel so much better to be able to just post in there and hear from actual board-certified plastic surgeons, hey, don't panic.
Yeah.
Or, hey, you might want to ask your surgeon this. Or, hey, try this. Like, they're not going to dispense direct medical advice, but it is a huge benefit to the group to have surgeons in there, which is so cool.
And that's our subgroup, Ask a Surgeon. So you can just type in Bustmob Ask a Surgeon and it'll pop up.
Yep. And if you're in the main group, you're automatically in that group. So you just need to refresh.
That's right. We hope you refresh.
Yeah.
Breaking news!
This is usually when we talk about plastic surgery news, and it was all lame sauce this week. So no news for you. Oh gosh, some sort of pop-up just happened. But I have questions for Jenny, which is always a disaster from Bustmob. Your questions.
Why is it a disaster? Oh,
because me trying to find them on my phone is gonna
be fun.
It's always like a fun surprise. Okay. Are you ready for Bustmob question number 1 this week? Okay, let me make sure my volume's turned up. Something is gonna happen, but
I want a breast augmentation, and I've heard there are a few ways I can have the implants placed. What are my options, and which one is best?
Got it.
there you go. Fun surprise.
I like that. So that's an easy one for me to answer. Placement is, she's talking about like different ways the implant can go in the body. So it's like your incision type. So there are 4 types. There's the belly button. Blech, it's weird. There's the armpit. A lot of people don't do that. And then there's the areola and the crease under here. And a lot of times people ask, well, what's the best one? Or which one should I get? For me, oftentimes I say, what does your surgeon prefer? Because that's probably what they're best at. But if I have to like zoom out, the crease incision to me seems to be the one that offers the best placement of the implant, because you're right there, and it's not like you're going through the armpit and you're just like a shot in the dark hoping you get it in the right spot. But the crease allows for better placement of the implant, and you're going to bypass a lot of those nerves and milk ducts that could be disturbed if you went through the areola. So keep that in mind.
That's super helpful. And we filmed some Amelia Academy videos in our app about that same question. So if you want to check that out, it's free. It's in any app store you use, whatever kind of phone you've got. It's called Amelia Academy, and there are hundreds of videos in there if you want to keep deep diving on implant stuff. So are you ready for another question? This one's more for me.
Yeah.
But let me play you a skincare question that seems really relevant given this time of year.
Okay.
My skin tends to be oily and break out in the summer. What moisturizer do you guys use when it's hot out?
Maybe personally, I wanted this because it is getting warmer, and I tend to be on the oily side sometimes, and people are often like, do I use the same thing? No, I think most people should not use the same thing that they use in the wintertime as they do in the summertime. I know. Well, I have a suggestion for you.
I'm ready.
Well, there's 2 products by Neocutis that I really like. I use both in the summertime, but one's Hyalus, like a really lightweight, almost a serum to infuse moisture, but it's lightweight. And then the other one is, instead of the Bio Cream, I switched to the Bio Gel. Like, again, think gel and lightweight in the summertime and cream in the wintertime. But you can get both of those products and read the differences and understand how to use them and if it would fit into your skincare regime at realsimpleskin.com.
Yeah.
So you can always check that out.
I've really liked that site. It's really made it super simple for me to understand skincare because I don't know much about skincare. So like me going to that site, it's like, it gives me a clear direction as to like where I should start and where I could end up if I'm like really into the game of skincare.
Good. Well, if you tend to be greasy and hot in the summertime with your skin,
I do.
Hyalus in the morning.
I'm
a big fan. Hyalus Plus. And then I use the Bio Gel in the evening as my night cream. It's a gel.
Gel cream.
Check that out. All right, third question.
All right.
Here you go. This one's for you.
I really need a revision, but I don't trust my original surgeon. I'm nervous I'll have another complication. Help.
Oh, I hate that. Like when I
know.
see that, I'm like, it really hurts my heart that people don't feel comfortable going back to their original surgeon because they didn't jive with them or they don't trust them. And that to me, that's really hard, you know? But we interviewed a Bustmob babe, Amy, and she was also an Amelia Aesthetics patient. And she had concerns, like she was having some issues before from a different surgeon. And so she came to like seek out a new surgeon at Amelia. And so we interviewed her on her experience with Dr. Roughton. And she is just over the moon.
Yeah. That's why having that relationship and going with your gut is so important, even the first time. I mean, hopefully nothing will ever happen to you and you will never have to go back to that surgeon unless you want to. But if you do have to, you want to be able to confidently and calmly and trust that they're going to listen to you, they're going to hear you, they're going to treat you with respect, and they can help you get to where you were ultimately trying to go anyway. So going with your gut is so important.
So important. Let's check out Amy's interview.
She's cute.
So thank you for doing this with me.
Of course, I'm happy to.
So the reason like I had reached out to you is like you've had a revision, you know?
Yeah.
And first of all, I love that you share your story and you're open about like what you've gone through, but we don't really get a whole lot of like revision surgery patients who can really like talk about it very well. And I'm like, you're like the perfect person. Like your before and afters are amazing.
Yeah. It's a
You know they
huge
are.
difference. Oh yeah. Yeah. Every time I talk to someone and they want to get breast implants, I'm like, go to this surgeon because if she can go from this to that, then you know
It's so good.
it's amazing.
You were an Amelia Aesthetics patient. You saw Dr. Roughton.
Yep.
And what was it that made you like you hadn't had a revision yet? You had some bottoming out and you could have just kept it and lived your life, you know, but there was something about like, no, you're ready to like pull the trigger, get it corrected. And what made Dr. Roughton be your girl?
So that was a process for me. My mother had a breast augmentation when she was younger. And I knew from a really early age that I wanted to have one eventually. I knew that I just was not going to develop breasts naturally. And I didn't. I had absolutely nothing. And so my first experience was just a huge disappointment. I mean, I hate to say that, but it really was. Not just the outcome and the bottoming out, but I kind of went into it thinking that it was going to be this easy process. I was going to have surgery and then I was going to have the breasts that I always wanted. And it was anything but that. I got a lot of like telling me what I wanted to hear and then things changed at the last minute. And I really didn't feel heard or cared for afterward when things started going wrong. I kept being told, you know, I think eventually you'll be happy with this. And I was like, but it's been eventually and I'm not happy with this. So I waited a while. I knew that I wanted them to be redone. I was not happy with the size. The width of them was very, very narrow for my frame. I'm not a very wide person to begin with, but the implants were very small. They were low 200s and high profile, so super narrow. And then, of course, the bottoming out and the scarring that I had was just really terrible. But I was so, I guess, just kind of torn up over how that went that I didn't have a lot of confidence in finding another surgeon. And I was scared. I was so nervous about going to someone and trusting someone to make such huge dramatic changes to my body and have it not turn out the way that I wanted again. And so I did a ton of research, so much so that I was actually having video, video consultations with plastic surgeons in California and was considering flying out to California to have a revision done. And then a friend of mine mentioned Bustmob to me. And I found the Facebook group before I found Amelia Aesthetics, and then found Amelia Aesthetics. And I went and I had my consultation with Dr. Roughton. And first and foremost, one of the things that made me feel really comfortable is the fact that she's a female and she's had surgery herself. So I felt like, okay, this is someone that can truly understand the way that a female can criticize their own body and how important it is not to achieve perfection, but to just feel comfortable and confident in your skin, and not to have someone telling you, well, you should just be happy with how it is. The second thing that made me pull the trigger with her was her honesty. She was very candid and upfront about what I could actually expect, what the realistic end goal could be. And that meant a lot to me because, like I said, with my first procedure, my consultation and even my pre-op was very positive and, you're going to get what you want. And then it came to the day of surgery and it was like, I think we're going to have to go a lot smaller because a larger size isn't going to fit. And I don't expect perfection by any means. But I do expect transparency when it comes to expectations. And that was such a huge mind twist to go from hearing one thing and then being told another. And so going into Amelia and Dr. Roughton being able to really kind of like lay out for me what I could expect and what would be needed to achieve the result that I was hoping for was just everything that I had been looking for. And of course, she has a background in reconstructive surgery with breasts specifically. So that was a big plus as well. But I just felt comfortable. It felt like talking to a friend or a family member and really open and honest. And so it was an easy decision from there. And I didn't have to go anywhere.
That's true. You were local.
Yeah.
So how many years between like your first breast augmentation to your second?
And my first was the summer of 2018. And then this revision was 2 years later. So it was last year in May. It was actually Cinco de Mayo.
That's easy to remember.
Yep.
What would you say to a woman who maybe is having bottoming out, but she's afraid to maybe go get a revision because it might not turn out the same? Like, what would you say to her?
The number one thing I would say is to trust your gut when it comes to a surgeon, and do your research and find someone that you really feel confident in. I did not trust my gut the first go around, and I think we all know how that turned out. I would, of course, recommend Amelia and Dr. Roughton to anyone, and I do all the time. But no matter what, whoever you go to, I think you just have to feel sure that you're in the best hands, and more so that they're going to be there for you after the fact. That was kind of a big thing for me at Amelia was I had seen via Facebook and the Bustmob group, and even just in a consultation, that you're a part of Amelia for life once you've been there. You're never forgotten. They are always willing to be there for you and take care of you. And bottoming out is a scary kind of issue to go through with implants because kind of like capsular contracture, it's one of those things that there's always the risk that it's going to happen again. So I think having that confidence in a surgeon is a huge factor. But also I would say, don't be scared. I was so scared. And looking back, I'm glad that I took the time to do my research and find the surgeon that was right for me. But I wasted 2 years being miserable with breasts that I was more unhappy with than when I had absolutely nothing at all. So I would just say, don't be afraid and, look around, find the right person and go for it.
And we're back.
She's great.
Yes.
And I really love her. Like, I cannot wait to kind of follow her journey on Instagram too, because she's being pretty open about it.
So open,
and
so happy.
Yes, seeing how she looks.
And she's in Hawaii. I don't know if you've seen her pictures lately. She's like out in the water, like topless. And it's just like, man, her confidence is... Thank you guys for joining us in the Car of Intention. We hope we've inspired you with some self-care tips. Brene Brown, we are out of coffee.
I was like, I can usually tell it's time to go back into the office when we've sucked it down and we're all getting a little shaky. But that was so great.
That was great. And thank you, Amy, for being vulnerable, telling your story. Like, it's going to help so many women who might need a revision one day.
Bye, guys. See you soon.
Thanks so much for watching. To join Bustmob, shop for swag, or follow me and Greta on social, click the links below. See you next time!